Hey guys, it's Dr. Wilder coming to you from my brother's house in Atlanta, Georgia, where I'm super happy to be seeing some family I haven't gotten to see in 2 solid years. So super grateful to these vaccinations that are allowing us to reconnect with family and travel a bit and travel safely. I mean, it's really nice when everybody seems to be getting along and doing their part and masking and that kind of thing. So thank you guys for joining me. I'm going to do a couple quick updates. As you've probably heard, the CDC finally went along with the FDA's advisory panel and the FDA and unanimously endorsed boosters for anyone 50 and up who is 6 months out from either J&J, Moderna, or their Pfizer vaccines. And people who are high risk or in high risk occupations can also consider boosters. They didn't have as much data to do a formal approval on that, but for those in a very high risk occupations or who have multiple risk factors, definitely consider getting a booster. And they're allowing mix and match of boosters. So the data is fairly reasonable that whichever boosters you got in the first place, you could get a different booster, particularly patients who got the J&J vaccine as their initial vaccine, really might want to consider a Moderna or Pfizer booster to get a much, much higher, what we call neutralizing or COVID blocking effect. The Moderna booster also has tended to, it's a much higher dose vaccine, so its neutralizing antibody effect is much higher than that of even Pfizer, although both are quite equivalent in terms of preventing hospitalization and death from COVID in severe cases. I also wanted to give a little update from the Institute for Functional Medicine, which talked about, what are some of the few things that we can really focus on that are preventable risks for severe COVID disease, hospitalization, and death. One of those number one things is high blood sugar. Blood sugar, and especially diabetes, type 1 or 2, is associated with over 3-fold higher risk of COVID infection, severe disease, and death. Weight, also a huge factor. Overweight and obesity, which is a BMI over 30, associated with a much higher risk of severe disease and death. And this is also true for influenza. So P.S., please get your flu vaccine too. Your COVID booster does not protect you against flu, especially if you're high risk or in close contact with people who are high risk. Just getting weight down 10% if you're overweight can make a world of difference in your risks. So work with us to aggressively do that. And note that both high blood sugar and obesity also impair your response to vaccination. So you're not going to get as good of a vaccine response if these problems aren't dealt with. Now, diet also plays a huge role. It is now known that vegan or pescatarian, which is vegetarian with fish, are extremely protective against COVID risk. Rates are 1/4 to 1/3 of typical, while a high meat intake is associated with a nearly 4-fold increased risk of COVID mortality. That's equivalent to being obese or diabetic. Vitamin D deficiency is also associated with an increased risk of severe disease or death. And that means we want to optimize your vitamin D level before you come across this virus. It's not going to help you once you're already sick. IV vitamin C failed to show a benefit in hospitalization, patients who are hospitalized. And again, if we're only focused on people who are hospitalized, we're too late. So which is why we really try to optimize all these nutrients early on. I want to comment a little about ivermectin, since many people are still touting this widely. And so far, the studies that have been completed have been of poor quality. Some were pulled for fraudulent data, and they're just insufficient to draw conclusions. There are over 30 studies ongoing, which should really help out tease out when, who, and what kind of dosing might actually benefit versus increased risk of harm. And unfortunately, poison control centers are hearing exponentially increasing numbers of calls regarding ivermectin toxicity, where people are taking veterinary products and repurposing it, and that is really not a safe thing to do. So at this point, we use it on occasion. I do not recommend it chronically for prevention. I would consider it if you are high risk and in a place where modern medical care is not available, particularly IV monoclonal antibodies. So if you're going to be in a third world country or Mexico or certain parts of the United States that don't have ready access to that life-saving treatment, then that might be a situation where ivermectin might be useful. And there are more data coming, and we'll see, and we'll modify our protocols as that comes through. Let's see, I think we updated the boosters. I want to touch a little bit on the Preventive Services Task Force Guideline on aspirin, which I appreciate many of you sending to us, because this is truly a game changer. So though aspirin is still advised in those with a prior heart attack or stroke, which is we call that secondary prevention, which is kind of an oxymoron. It means prevention after you've already had an event. It is no longer recommended for routine prevention in people over 60 who have no history of heart attack or stroke. The risk benefit is still slightly favorable in people who are 40 to 50 with a greater than 10-year risk, and you can calculate, we calculate your 10-year risk via the American Heart Association risk score, and and you have to have a low risk of bleeding to make aspirin make sense. Now, this all makes sense as the population has changed. In the last several decades, Americans are smoking less, so that's less clot risk. They are drinking more, so bleeding risk is higher. In general terms, we've also put NSAIDs like ibuprofen, Aleve, naproxen over the counter. So those increase bleeding risk, and they negate the benefit of aspirin in cardiovascular prevention. So that's been a game changer. The big caveat, I will say, is these recommendations are very broad brush. They are just guidelines. They do not take into consideration a lot of factors that we do in evaluating your specific cardiovascular risk. So we may still recommend aspirin prevention in older patients with very specific risk factors like lipoprotein A, genetics, or the markers of unstable artery lining. You'll hear me talk about Lp(a)2, or unstable plaque on coronary imaging, because those are all imminent risk. Some of those are imminent risk factors and definitely up your clotting risk, provided we keep your bleeding risk low. So that's the balance that we're always trying to tread. So just touching a little bit on prevention and my big goals for every LifeScape patient. You know, again, I've said repeatedly, I think one of the biggest failings in American medicine is the presumption that most chronic diseases must be managed rather than reversed or ideally prevented from ever happening in the first place. And, you know, sadly, we excel at rescue because crisis is compelling. Right? Crisis necessitates action. Prevention is not as exciting, it's not as sexy, but as they say, an ounce of prevention is worth tens of thousands of dollars of cure and decades of healthy life. So our mission is to inspire and empower health transformation. That speaks to your power, the power in every patient, given the proper tools, guidance, feedback, and support to transform your health to a totally different level. So in just a handful of physicals in the last several weeks, I have witnessed patients who've improved or resolved chronic fatigue, diabetes, neuropathy, inflammation, pain, high lipids, cardiovascular risk, kidney failure, even cognitive impairment. Medications did not fix these problems. They can sometimes play a supporting role. Meds and supplements are Band-Aids. Lifestyle and our choices hold the keys to the cure. So these wins resulted from mainly small habit changes applied persistently. So with the mindset of prevention, I want to share my 5 goals for every LifeScape patient. And our goals are that no patient ever progresses to type 2 diabetes, requires vascular surgery or an amputation, suffers a heart attack or stroke before the very end of life age greater than 80, requires dialysis for kidney failure, or outlives their brain. Now, these are really ambitious and not always achievable, but really worth trying because we can. Imagine the healthcare savings if all Americans and their physicians focused on the root causes of these very attainable goals. Medicare spending and insurance costs would plummet. Life expectancy, which has been declining since 2014, and more importantly, healthy life expectancy would absolutely soar, and we wouldn't spend decades of our life disabled, tethered to dialysis, or institutionalized with dementia. These problems start, though realistically, decades before they emerge. So the earlier we engage with people, the better. But these transformations, I tell you, can happen at every age. I don't care what age you are, there is opportunity for improvement, and the body has incredible resilience. So sadly, each American generation's been less healthy than the one preceding. So we have a lot of work cut out for us. And we've already had to shift colon cancer screening 5 years earlier because of high rates of colon cancer in young people because of these ultra-processed, low-fiber diets and lots of added sugars. So while we look at lots of different root causes for every one of these problems, the core basics are very, very simple. Number one is diet. The more we shift plant-based, whole foods, things without a label, right? Avoiding refined and processed foods and added sugars, absolutely foundational to preventing every single one of those causes. Hydration, many of us fail to consume sufficient water, and this is really underrated, but every body system needs adequate hydration to function normally. Your kidneys, your brain, your heart, your entire vascular system, you name it. Cognitive issues can be magically helped by just consuming enough water. It's crazy. Again, getting active, getting moving at least 150 minutes a week, not rocket science. Sleep 7 to 8 hours a night, and putting your electronics to bed for the night. Treating sleep apnea, which is really an epidemic and critical to the brain and to cardiovascular health. Avoiding tobacco, of course, in any form. Every patient that I've had who's needed a vascular intervention, tobacco has been a contributor. And then minimizing or even eliminating alcohol. This is a brain toxin. It's a carcinogen to the breast, liver, and the entire GI tract. And The Lancet published a global study on alcohol consumption, concluding last year there is no safe level of alcohol consumption, none. Recent studies showed any alcohol consumption increases the risk of atrial fib, which is a big risk for stroke in our patient population. And a recent study revealed even a single bout of heavy drinking is associated with markers of direct heart injury. We're talking heart attack, heart failure. So we call it the holiday heart, is real. So none of these are rocket heart science, but to change a habit, we have to get laser focused on why changing this habit is important to you, because without a why, there is no will. We have to engage those around us to support it, or steer clear of those who might sabotage our efforts. And you need to create your environments for success, get rid of those temptations, and devise healthy substitutions that work for you. Work with Dana to do that. And create mini habits, tying something you need to do with something you already do mindlessly. Like when I'm brushing my teeth, I might do squats or toe-ups to exercise my legs. Or my mom had a great habit of for hydration of when you empty the tank, fill the tank. Again, our mission is to inspire and empower, because we cannot create health. The heavy lifting is on the patient. So it's on you, should you choose to accept it, which many of you do, and makes me so happy. Nothing makes us happier than seeing people achieve their own brilliant health breakthroughs. And so we want to thank you for inspiring us and honoring us with your health as we celebrate 18 years of learning and growing with you. So I'm going to see if there's any questions that we have on. my technical adeptness is not that great. So if I don't get to everybody, let me know. And I am not seeing any questions right now, but please do share this with friends, family. We want to make sure that we reach as many people possibly with these messages of how to empower your own health. Thanks for hanging with us, and have a wonderful weekend.